This is my audience. Today in the United States, there are hundreds of thousands of regular injection drug users. One huge issue that comes along with injection drug use is the spread of diseases. These are spread by dirty needles and needle sharing between the drug users. HIV and hepatitis C are both common diseases that are transferred by injection drug use. These diseases are chronic diseases and they cannot be cured but only treated. When we think about injection drug users, most of us think of ways to prevent them from using drugs or to help them become clean. But there are other options to help prevent the spread of disease for the people who don't want to become clean. Needle exchange programs should be encouraged throughout bigger cities and cities with known injection drug use. Needle exchange programs are programs that essentially trade the dirty needles and drug supplies for clean needles. YourFirstStep.org says that needle exchange programs is a harm reduction program that allows IV drug users to receive clean needles and give them space to dispose their dirty needles in a safe fashion. It also says that depending on the needle exchange program, a variety of different treatment and referrals are offered along with HIV testing. There are three main reasons that needle exchange programs should be encouraged. The reasons that support encouragement of needle exchange programs are that they prevent needle sharing and the reduce of spread of disease. They decrease the overall cost of health care and treatment that comes from IV drug use population. And the last reason, that it increases the opportunity to communicate with the drug using population. The first reason is to encourage needle exchange programs is to prevent the disease passed through the needle sharing of dirty needles. HIV and hepatitis C are two main diseases that are passed along through IV drug use. AIDS.gov says that it is known that 10% of HIV cases annually are caused by injection drug use. It also states that HIV can spread from sharing the drug preparation and injecting equipment. A person with HIV can then pass the disease by having unprotected sex. This population is more likely to have unprotected sex because when they are high, they do not always recall what they are doing or make the best choices. NIP.edu states that needle exchange programs not only distribute clean needles, but also distribute free condoms. This would also decrease the transfer of HIV. According to another source, ACLU.org states that because mother-to-child HIV transmission, roughly 35% of all AIDS infections can be related to injection drug use somehow. So these diseases can be directly or indirectly transferred by the drug users. By removing dirty needles out in the communities, it decreases the risk of IV drug users to spread the disease. According to ACLU.org, nearly 25 million used syringes were removed from the communities. Another fact from ACLU.org stated that one-time use of sterile syringes remains the most effective way to limit HIV transmission, and that needle exchange programs reduce the HIV transmission rates by 1/3 to 2/5. The second reason to encourage needle exchange programs would be to decrease the cost of treatment. Needle exchange programs are provided by the government, but there is not nearly enough support because of this being such a controversial issue. Avert.org stated that the number of syringes needed per person who injects drug use is around 200 a year. But with the money they receive, about only 23 syringes are provided. If they were to receive the correct amount of supplies needed, the cost of what is provided would still be less than the cost of the health care of someone who has HIV. ACLU.org stated that it costs an average of $160,000 to run a needle exchange program, which is about $20 a person, whereas one syringe-infected AIDS patient will require upwards of $120,000 per year in healthcare costs. If more was spent by the government to provide needle exchange programs with the supplies needed, it would ultimately save the government money because less people would be having HIV. The last reason a needle exchange program should be encouraged is that it increases the opportunity to communicate to drug users. Many needle exchange programs not only provide clean needles, but also provide a variety of services to help patients with their addictions. This also gives nurses the opportunity to use therapeutic communication to give the best possible care to their patients. Psychology Today says that needle exchange programs can help engage drug users in mental health or substance use treatments even if they have had a history of refusing similar treatments before. ACLU.org also said that 97% of needle exchange programs provide a range of public health services that include referral to substance abuse treatment, prevention educations for sexually transmitted diseases, HIV counseling and testing, and tuberculosis screening and primary health care. Although many people believe that needle exchange programs in their community will increase the drug use and dirty needles on the streets, they are wrong. Many cases have proven that needle exchange programs have the opposite effect on communities. PsychologyToday.com stated that because needle exchange programs are not forcing people to change their lifestyle, they often reach hard-to-reach populations who have refused IV drug treatments before. Needle exchange programs should be encouraged because overall they make communities safer and decrease the risk for people to develop lifelong diseases. Although the needle exchange programs can be pricey, if you look at the big picture, it saves money in the long run. Safety and health is something wanted in all communities. Needle exchange programs help increase both safety for drug users and those not using drugs as well. And they also increase the overall physical and mental health of communities.